9 a.m. from Fox 35. This is Good Day Orlando.
Also, beyond Botox, the new anti-aging treatments that will take years off your face but still leave you looking like you. Get rid of wrinkles, tighten your skin, take years off your face, and still look like yourself. Well, doctors are now using less invasive and less distorting anti-aging treatments for ladies who want to look younger without going under the knife. And joining us right now to talk more about it is Dr. Armando Soto, board-certified plastic surgeon of Aesthetic Enhancements. Great to see you, as always.
Nice to see you, Amy. Thanks.
Okay, so first off, you brought yourself
I brought a toy today.
A toy today. I love it. It's called Skin Pen.
The Skin Pen. This is our new toy.
What is it?
Well, it's a little pen, and when we turn it on here, it's got a permanent marker in it. We use it to mark up your wrinkles so you don't see them anymore. I'm just kidding. No. What it does is it has these tiny little needles in it, and the little needles kind of create micro punctures in the skin. And those little micro punctures, as they heal, will cause the skin to tighten and increase collagen production by up to 400%.
Wow.
Right. So one of the things that happens as we age is we make less collagen. This stimulates younger levels of collagen production. So it doesn't change your appearance. It just makes you look the way you used to.
Wow. Okay, so we've had a couple of stories lately of celebrities who are coming out in the media and they look very different. And people are saying, oh gosh, what did she do? Are you hearing more women coming into you, and men too, who say, I want to have something done, but I don't want people having that shocked look when they see me either?
Absolutely. Yeah, that's a big concern. And you know what I tell my own patients is we got to be careful and make decisions the right way, because weird is not a victory, right?
Right.
What we want is for you to look good but look inconspicuously beautiful, natural looking. So we want to make decisions in a way that's going to keep you looking like you, just younger and fresher.
And that's why something like this is good for that.
It's fabulous, yeah. Combined with other things like good skin care and things that we might do, depending on what your individual problems are, this is a great adjunct.
What are some of the biggest things that we're doing wrong, Doc, that you see over and over?
Well, I think that it's hard to generalize, but I think one of the more common mistakes that I try to steer people away from making is choosing the road that they want to be on. In other words, choosing a procedure based on its cost or its recovery or what they've heard or read, rather than choosing an outcome and a provider. Those are the things that I think are going to guide you along the path to a safe and pleasing outcome. You don't want to choose a procedure. You want to choose a good provider and have them guide you to the destination you want to get to.
Do you find that non-surgical procedures are becoming more and more popular?
Absolutely, yeah. Everybody wants cheap, quick, and easy, right? And I think that's fine. You know, it's good to want those things, but we have to understand when we have to make an investment in time and a financial investment to get what we really want safely.
Right, absolutely. What do you see as the next big thing? Where do you feel this technology is moving toward?
I think we're going to keep moving towards more less invasive and non-invasive options. There's going to eventually come, I think a pretty strict boundary where we can't get too much more, without doing something invasive.
Right.
But I think that if you start a little bit younger, and that's what we're seeing with the celebrities that you referred to, Jennifer Aniston, Gwyneth Paltrow, Demi Moore, some of these other celebrities, they look so good at ages that we're not used to seeing people look that good at, because they did start young and they started with smaller procedures like skin pen treatments and therapy, which kept them looking good beyond points where other people would have had surgery.
Right. If you wait till you're 60, in a lot of cases, it's oftentimes too late.
Yeah, you might need a bigger procedure at that point.
Okay. Dr. Armando Soto, your website, please?
www.drarmandosoto.com.
Always a pleasure.
Nice to see you too, Amy.
That thing looks really cool.
Yeah, it's fun.
All right, 9:21 right now.
Scars. What's great about the Skin Pen is this has tiny little needles, and these make very defined holes in the skin, and you can see that. Now what's so great is I used to just go under the skin, but now with this I can just go on the skin and virtually with no downtime, just turn her head a little bit this way, and just with really no downtime, you can improve that acne scar. It takes a few treatments, but in a few hours she will have no redness, no mark.